remember going to the doctors all the time as a kid, but as I got older, the less and less I would go. This is a common theme for women, but why? Here to break it down for us is the vice president of the largest health and well-being platform in the United States, Healthgrades. We have Faye McRae. Good morning, Faye.
Good morning.
So, Faye, I have to admit, I avoid going to the doctors if it doesn't seem urgent. What are you noticing as the underlying cause of women not committing to their yearly health checkups?
Yeah, well, that's not uncommon. Women are really the primary healthcare managers in their homes, whether they're married or not, whether they have kids or not. Women are placing the needs of everyone around them above their own, and they're avoiding their preventative care. And we found that the leading cause of delayed or canceled appointments is cost concerns. So, 1 in 3 women say that high out of pocket expenses are a top reason that they've delayed, avoided, or even skipped medical care. Another common reasons that women skip care is convenience factors, like forgetting to schedule your appointment or finding options that are available inconvenient for your schedule.
Yeah, especially when we're so busy. And like you mentioned, you ask any mom, their kids come first. For me, it's everyone else but myself. But if my friends or family are ill, I'm telling them to advocate for their health while I'm not doing it. So I guess my question to you is, how do you suggest healthcare providers market towards women so that we make our health a top priority?
Yeah, first I would say just make it easy for us. Things like online scheduling have really been a game changer. You don't have to wait on hold anymore to make those appointments. So, also setting reminders, not just appointment reminders, but reminders for your screening. So, I know I live for a good, series of text messages reminding me to schedule mammograms or reminding me that I have an appointment coming up. So, that's super helpful in making preventable care more accessible. And also just making cost information transparent. We want options. We want to know that there are ways that we can help defray the cost of hefty medical bills. So really knowing your options when it comes to cost, marketers can really, do a great service to the community by making those things more available.
Yeah, all really important key points, making it easy, accessible, and transparent, like you mentioned. And during the pandemic, people became more cautious towards their health and tracking symptoms. Did this change women's attitudes towards making appointments as well?
Yeah, so although women's confidence in going to the doctor has returned to nearly pre-pandemic levels, our study found that over half of women still skip necessary preventative care appointments. But fortunately, we also found that nearly half of women are taking their health more seriously than before the pandemic. So it's really opened the door for doctors and healthcare systems to have an opportunity to engage women and motivate them to prioritize their own health care.
And now that we're focusing more and more on our health, making those appointments, how do race and gender factor into women's decisions when they are looking for a physician?
Yeah, so while our study didn't indicate an explicit preference, studies do show that satisfaction and outcomes improve when a doctor shares your gender, your race, or even your ethnicity. And women in our report were more likely to indicate that they trusted their doctor when their doctor was also a woman.
All right, all important key tips to know so that we're making sure we're getting those checkups annually as women. Thank you so much for joining us today, Faye, and we can all take advantage and feel better about finding health care. For more info, visit healthgrades.com.